While we may observe deficits in social communication and interaction in all children, what distinguishes children on the spectrum is the number, severity, and persistence of these deficits and the impairment in daily function. Without treatment, these deficits are likely to initiate a vicious cycle and to become more impairing over time as social demands on your child increase with age. Deficits in social emotional reciprocity are characteristic of children with autism. In some instances, a child with ASD may initiate social contact with inappropriate touching or even licking of others. More frequently, you will observe that your child will not initiate a conversation or will engage in one-sided conversations, starting abruptly with topics unknown to others, will not introduce the topic or clarify them, or make connections that are only known to them. Among the most frustrating behaviors for parents is the reduced sharing of interests and the lack of expected emotional responses. The child may not point at objects or of interest to engage others, will not respond to smiles or praise, and will display in general little enjoyment or excitement, also show indifference or aversion to physical contact or affection. Some of these are the early symptoms that alert parents and caregivers to seek an assessment for ASD. Children on the spectrum tend to display a lack of initiation of social interaction. They only initiate interaction when seeking help. They also display a poor social imitation, the ability to pick up on cues and imitate behaviors from other people around them. And one of the most noteworthy symptoms detected rather early in the child's age is a failure to engage in simple social games. A child on the spectrum will also show problems with nonverbal communication. They'll display impairments in the social use of eye contact and have a difficult time understanding and using proper body gestures, and also an inability to understand those gestures when coming from others. In terms of the volume, pitch, intonation, and voice, they tend to be abnormal or particularly rigid. Other difficulties with nonverbal communication include an impairment in the use of facial expressions tend to be exaggerated, an overall lack of warmth, and an inability to make coordinated use of verbal and nonverbal communication, thing that neurotypical children will do. You may have heard of the lack of theory of mind in autistic children, which can be summarily described as a pronounced inability to take another person's perspective. This manifests itself in many forms. For example, not noticing another person's lack of interest or another person's distress, not picking up on social cues, and not learning from experience or imitation. There's also an overall lack of understanding of social conventions and appropriate social behaviors, which result, for example, in inappropriate questions or inappropriate statements. When in a social situation with other children their age, a child with ASD will have difficulty establishing friendships, will not engage in cooperative play, and will not play well in groups of children, for example, following the accepted rules of the game. One of the effects of these social skills deficits is that the child will often seek to play with younger or older children as opposed to children the same age or the same developmental level. These behaviors are most noticeable to outsiders and contribute also to the social isolation and stigma associated with autism. Overall, children with ASD will show limited or no interest in others. They will be withdrawn in their own world, will be generally oblivious to others, and will show a preference for solitary activities. These behavioral deficits are key targets of early intervention. ABA therapy has shown great promise in addressing them and reducing the impairment associated with them.